Vicente Salcedo comes from Valencia in Spain, and he's been working on an international project with partners in Norway, Greece, and in Sweden. The title of his talk is Education of IT Skills for the Healthcare Workforce in the EU and the US, an Analysis of Opportunities. So thank you very much, Vicente.
Okay. Thank you very much for your kind introduction and for your words. This is one of the presentations dealing also with the CAMEI project that we have been talking about in some of the sessions. And well, this is just a report that was part of the white paper that we produced. So main topics of this white paper was an introduction about the socio-economic factors that were the origin of this project, the target users and the expected benefits, a short analysis that we already performed, something about the context, because at the end, if we want to draw a strategic plan or a white paper, we need to know the context, and the opportunities and recommendations that we produce for the European Commission and some key conclusions. So with all of that, at the end, we produced this white paper. That this is also, please note, this is a living document. This is already available in the CAMEI website, and you can already download. And any comment that you may have or any idea about something is missing, please feel free to contact Stathis Konstantinidis, because we are willing to collect those new ideas. I mean, you already know some of this data has already appeared, but just to give you, again, an idea about if we consider the total workforce in the European Union, at the end, the healthcare sector, it's around 10%, and it's around 9% of the gross domestic product. And if we consider the expenditure, it's being increased at a faster rate than the GDP. So in most of the OECD countries will be around 16% in 2020. If we consider the United States of America approach, it's even worse. You know that it's even higher than 15% of the GDP, the healthcare cost. Even that doesn't imply better quality than Europe, but that's almost twice the amount than other industrial nations. And that's maybe one of the key issues. 1/3 of the budget is spent in not direct care attention, but in bureaucracy or other overheads. So both, and that's why both entities signed what Stathis introduced before about the memorandum of understanding. They acknowledge this demand for adapting IT for meaningful skill building in the healthcare workforce. And some points were especially raised. First of all, that nowadays health providers need to develop new skills for the use of ICT, because at the end ICT can enhance the communication processes at different levels among the healthcare workforce, but also with the patients, providing information, but also public health. Well, there are different media to provide this kind of interaction: email, SMS, chat, forum, websites, Facebook, and another media. And everything needs to be addressed. So at the end, an agreement was done between the EU and the US about target this kind of skill experience, just not to reinvent the wheel twice or even more times, but not only addressing the public sector, but also companies and private sector that sometimes they are willing to participate at different levels in the European Union or the US, but I mean, there's also a place for the private companies. 4 were the main target users that we were aiming at, and those expected benefits from the point of view of health policy makers, just to identify which are the key barriers for the mobility of IT skilled people between both areas. About education policy makers, the set of IT competencies at the international level, because it's still a challenge and a discussion. For the healthcare workforce, they are expecting an international accreditation system and a pool of knowledge, and from IT researchers in the field, a strategic framework for technology standards in healthcare education, where semantics, as Stathis said, is playing a big role. We already played a SWOT analysis of all the programs for the provision of IT skills in this, for these people. And let me summarize the major funds. First of all, we found a good team of teachers with vast knowledge and expertise in the field. And all the stakeholders were very aware and they have a good willingness to participate in initiatives and also provide feedback for improvement, and that was a good point. Some weaknesses were that most of the programs are all just focused on a single topic, what's not so bad, but without having into consideration the whole picture about the needs of this healthcare workforce. And when I'm talking about healthcare workforce, I'm talking not only about GPs or nurses, but about everybody who is at the end playing a role in the healthcare provision in a hospital or in an ambulatory center. There's also a problem because a common language is lacking, and the contents need to be adapted and updated periodically because at the end the demands are changing, and at the end versions and whatever is changing. About opportunities, there are some opportunities about accreditation standards and competencies in IT skills. It's also a good time just for dissemination and awareness activities or marketing activities, and it's also, we have a chance to make assessment to offer personalized education based on existing previous models. There's a lot of information, but the problem is that we don't know how to get it. About some threats, that there are a lot of multiple courses and platforms attempting the same goal without a clear winner. There's also a frustration from the workforce about the feeling to check validity of any training at other territories. So maybe this course, it was a award for Spain, but not for Greece or not for Sweden, and it's not properly recognized. There are a lot of multiple stakeholders and laws, so there are difficulties to reach agreements. And also when we are talking about skills, the issues that, for example, a nurse is not playing the same role in Spain, in Austria, or in Sweden. So it's something that makes that we need a very complex system just to make this work. About the contents, we were also discussing that the contents for medical education are heterogeneous and they are requiring periodical updates. Most of the e-learning programs have these specific topics with a global approach, and common accreditation is still on the way. So open education, MOOCs, and games, they are fancy and cool words, but they are accepted as the norm, but still a huge work needs to be done. There are different repositories of related courses, and we need to offer personalized education because one size doesn't fit all. So we identify very clearly 3 ICT market segments that was part of the work carried out also by people from Karolinska, and 3 segments were identified: technology standards in healthcare education, strategic R&D, and IT skill programs for educational activities. About the major recommendations that we already performed, for example, in technology standards, was just to create a pooling of expertise and resources and create a strategic framework for technology standards in healthcare education, and build or leverage joint systems to implement those standards. From the point of view of strategic R&D, to create joint policies and action plans, make a common EU-US approach for certification and accreditation, and also to stimulate the involvement of US partners in further easy funding calls. And concerning educational activities, promote open and flexible education with initiatives such as MOOCs or some regulatory guidelines. So about benefits, I think that all of us are aware about the benefit, but I mean that needs a very joint and large collaboration. We need to share educational content, high quality content, but that's the way. And that's the only way also to measure how these activities would produce an impact on this personnel. And accreditation would be a main driver. From that perspective, and the knowledge and investment would create a standard. About key conclusions, work on standards is often replicated, and a synergy of expertise between the EU and the US is strongly recommended. We need to create open access sustainable education offering, mainly using MOOCs. And we need to make that the European Union and the US are sharing similar implementation challenges and barriers, and co-develop a cost-effective and efficient implementation model for a lifelong educational program. And finally, just to create a common standard for accreditation. And that's all from my side. I'm open for any kind of question that you want to raise. Thank you.
One of the points you made was that the roles of, for example, nurses, GPs, consultants differ across the different countries. I wondered if there's any mileage in thinking about, rather than a complete role, about role components. So you tailor an assessment to a particular component of a role, and then you amass those together to then give a common standard.
I mean, this is a very good and nice question and a real challenge. At the end, the point, frankly speaking, the issue is that the European Commission fund with a very small amount of fund the project, and we were quite ambitious, but we need to reduce our scope because okay, that was our initial aim, but at the end we need to do it just based on reports and not so long as we already did. In any case, the European Commission is quite happy with us, and well, for the further calls, they are expecting to continue the work with some activities like the one that you are proposing.
Oh, that's
and we will be also happy to share this new initiative with some of you. So please, you can also contact directly Stathis just to see how we can cooperate together just to deal with this issue.
Oh, that's really helpful. Thank you. Any more questions? Well, thank you very much, Vicente.